Hello, my name is Abby, and in this presentation, Emmy and I will be explaining exercise science. Exercise science is how and why the human body responds to physical activity. There are many subdisciplines within this broad term, and we are about to explore them. First of all, motor control includes reflexes and directed movement. The nervous system uses sensory information to tell muscles to move. This is seen in the image of the brain obtaining information and processing it to control movement. Motor learning is the change in improving motor skills. For example, this cute little girl is learning how to walk. Epidemiology in exercise science includes factors associated with participation in a specific behavior, that is, physical activity, and how this behavior changes and relates to the probability of disease or injury. In the picture shown is an example of someone doing a box jump, because there are many factors in form or intensity that could increase her risk of injury. Another example of epidemiology in exercise science is how exercise decreases the risk of heart disease. Biomechanics is the study of the mechanical laws relating to the movement or structure of the body. An example of this includes design in the orthopedic industry to create new joints, prosthetic limbs, or other fixations for the body. Sports psychology is the study of how the mental factors in sports and exercise impact performance. There is a strong connection between the body and the mind. Sports psychology includes aspects such as motivation, confidence, stress, and goals. Not only like scoring a soccer goal to win, but like creating motivation and excitement to reach a higher level of performance. Physiology deals with the abnormal functions and the normal functions of living organisms and their parts. The picture shown is an example of a man kicking and how his muscles are moving. This is used in exercise science because if your muscles and joints aren't working correctly together as they should be, you may already be injured or have an injury that could happen.
Next we have measurement. In exercise science, one must measure a variety of things to acquire data. Measurement is very important because information and data can be drawn from measurements. For example, blood pressure is an important measurement in health. Then we have evidence-based research and practice. Evidence-based research is using credible sources and finding information that you are sure is accurate. This includes peer-reviewed articles and textbooks. Evidence-based practice is a problem-solving approach to clinical practice that combines the best evidence, the patient's preferences and values, and the resources available to make decisions about patient care. For example, drinking pickle juice to prevent cramps or using kinesio tape to increase range of motion based on experience and the client preference despite what research shows. Technology is a major part of exercise science. This picture shows a bod pod. Exercise scientists use this to get an accurate measurement of body fat. Other examples of technology are heart rate monitors, gym equipment, and smartwatches. Anatomy is extremely important because when one understands the human body structure, it can help them understand their relationship to movement, growth, injuries, technique, and how the body responds to exercise. Lastly, we have careers. There are several different career fields available for exercise science majors. Athletic trainers, physical therapists, kinesiologists, PE teachers, nutritionists, dietitians, and coaches are a few of those options. We showed you an example of an athletic trainer taping someone's ankle before they go train, a physical therapist or athletic trainer helping someone rehab an injury, and a coach coaching. Overall, exercise science is a fun and exciting career path with multiple different opportunities. Thank you for listening to our presentation.